Hello, thank you for your interest in our study. I'm Grace, I'm the study lead, and I'll give you a brief overview of the DMED study and what participation involves. So what's the problem we're trying to address with the study? Well, older people living with both diabetes and frailty have a complex medication regime, and patients are often overprescribed medication by their GPs. So this overprescription can lead to adverse treatment effects, large volumes of ambulance call-outs, and an increase in hospital admissions for falls and fractures. So the aim of the study is to assess the use of an electronic decision support system in the de-intensification of potential inappropriate medications. The study is a pragmatic, cluster randomized control trial, and it will be delivered in primary care practices across 3 to 4 regions in the UK. We are looking to compare practices in the intervention group and the control group, which consists of practices continuing their usual care. So we are recruiting 40 practices in total, and a randomization process will allocate 20 practices into the intervention group and 20 into the control group. Practices must have a minimum list size of 4,000 patients. Data will be collected from patients who are 65 years or over, living with type 2 diabetes, and present with moderate to severe frailty. Practices allocated to the intervention will be invited to attend a de-intensification online training webinar developed by our clinical education team, and they'll have access to an algorithm to support them during the de-intensification process. Healthcare data will be extracted at baseline, 6 months and 12 months, and the intervention group will also have an additional data extraction at 3 months. And all of this will be carried out by our external software company from the University of Nottingham known as Primus. Our primary outcome is to assess clinical data that's routinely collected in diabetes care. So for all practices who are participating, you'll need to sign a data sharing and remote access agreement with the University of Leicester and Primus, and a staff member, most likely a GP or senior member of staff, will be required to provide informed consent on behalf of the practice. The practice will also be required to support Primus with the data extraction at the time periods previously mentioned. So this will be done remotely by Primus, so we only ask that a staff member allows the remote access for data extraction, which will take approximately 30 minutes. All patient data is pseudonymized, and GDPR is followed at all times. And Primus have significant experience in secure patient data extraction. For practices that are allocated to the intervention group, at least 2 staff members with prescribing responsibilities are invited to complete an initial online training webinar on the de-intensification of medications, and this will last approximately 45 minutes. The electronic decision support system is installed onto the computer, and the software will automatically identify eligible patients on the system. Alternatively, staff can run a search themselves. So once eligible patients have been identified, they can be invited for a structured medication review, and GPs and healthcare professionals can use the algorithm provided to undergo the de-intensification process. Any changes to patient medication should then be recorded. We also have 4 5-minute online booster training modules for staff to complete during the 12-month study period. Further support is provided by your local CRM, Primus in the case of the software management, and NIHR ARCs. Thanks again for your interest in the DMED study. Please feel free to get in touch if you have any questions or would like further information. You can contact your local CRM manager or myself at the email address provided. Thank you.